the cloth, and I've got some water in here, and I want you to use that washcloth to wash your face.
Depending on the type of stroke a person has and how quickly they receive treatment, stroke outcomes can vary significantly. Stroke patients may need physical, occupational, or speech therapy as part of their recovery.
Rehab services is made up of physical, occupational, and speech therapy. Each of those disciplines in their training have very similar elements to study, but then also each has their own particular emphasis of their discipline. So that's why the team approach is so critical to the success of the patient.
Put the numbers on the face of a clock.
Therapists in Eisenhower's Multidisciplinary Rehabilitation Services Department are part of each patient's journey from stroke patient to stroke survivor.
You want to establish normalcy. You want to get somebody back to doing their normal activities. With occupational therapy, you're using the occupation, which is a normal activity, as part of your therapy. And anything you have done in the past, you already have a memory for. And as you use that in your treatment, people get better faster. The two go hand in hand.
Occupational therapists can help stroke survivors regain their ability to engage in a wide range of daily activities by working one-on-one with the patient to understand their needs, activities, environment, and potential limitations.
Now you're doing so well, we're going to try something a little bit more complicated.
Okay. In occupational therapy, we would take activities such as using clothespins for pinch to develop strength that would then could build on for grasping a pen, and then from there you would work in basic writing skills. You do activities that are like an exercise, not exactly like a physical therapist would do, but they're more of a functional type activity to increase strength, coordination, or movement, and would include some visual components that then you would put into a daily activity such as writing.
That's it.
Eisenhower's Activities of Daily Living Lab offers patients an environment to practice critical skills.
When we first meet them, they're feeling very down. They know what's happened, and they need someone that can reassure them that we're gonna help you move from here. We're gonna help you get home. Our whole goal is to help you achieve your goals. In the outpatient setting, they have weights where the patient is able to work on their strengthening with weights. They have the parallel bars where a patient can work a little more on balance and walking. They feel secure in the parallel bars. There's a little bit more support. We have stairs built in the outpatient gym so they can practice ascending and descending stairs, simulating curbs, and being out in the environment.
And so you're going to go ahead and stretch your leg out behind you.
We have mats for exercise training, and again, that goes for core strengthening and balance. That even takes place on mats. The Swiss ball activities where they're sitting on a ball and working on trunk strength, balance, coordination.
Straight out?
So we just keep building on it and try to fine-tune the patient.
Okay.
Speech therapy is the third integral part of a stroke patient's recovery. At Eisenhower, speech therapists interact with patients both at the bedside and on an outpatient basis.
And telephone. Terrific! Good job!
At the bedside, we've performed different tests by asking them questions, to name objects, to answer yes-no questions, to follow our directions, to eat different types of foods, to ask them personal information questions, to get a feel for how much they can understand, if they can verbalize their wants and needs, and if they understand what we're asking them.
Speech therapy does more than help patients communicate. It can address concerns with swallowing that may result from a stroke and facilitate recovery from other neurological deficits.
Eventually, they'll come for outpatient therapy when they're stabilized and they're able to do more things, and then we continue to sort of fine-tune the difficulties that they're still having in terms of if they're still having problems with swallowing, or they're not able to completely verbalize their wants and needs and feelings, or if they're having difficulty with their memory, their thinking, their reading, or their writing at a higher level, then we can work on these things and outpatient and give them resources to take home and come back with to follow their progress.
Eisenhower Medical Center is one of only 5 centers in the United States participating in a clinical research study on stroke rehabilitation using the AIMS device.
It is an assessment of a machine that provides vibratory stimulation to muscles that are recovering from stroke. The inclusion criteria is that the patient must have had a stroke within the last 4 months.
Participants in the AIMS study come to Eisenhower 2 to 3 times a week for 6 to 9 weeks, with a final assessment to determine if their functional abilities have changed.
The actual machine itself provides vibration at the muscle tendons of the hand and wrist and ankle. And the patient is also instructed and is performing exercise in order to see if the vibration itself is enhancing the motor recovery of the patient. The training of all 3 members of the rehab disciplines is such that we're acquainted with the stroke recovery process. And to many patients it might seem very overwhelming, and I'd liken it to running a marathon. If you don't train for a marathon and all of a sudden you're thrust on the starting line, you could be quite overwhelmed with where you're going to go first. What our disciplines are really effective at is trying to help the family and the patient understand that they're not running all 26 miles at once, they're running mile to mile.
Coming up, Eisenhower Neuroscience Institute helps patients with a wide variety of diseases of the brain and spine. See 2 very special programs for Parkinson's and Alzheimer's diseases at work.